Hi, I'm Dr. Mel Burchman, and I'm proud to be one of the founding fathers of GMA Laser Education. I introduced lasers into my office 23 years ago and now have 8 lasers there. I would not practice without them. When I teach a beginning laser course, I always ask the attendees to think about the following question. If you or a family member was getting an eye surgery done tomorrow, would you want it done by laser, scalpel, or electrosurgery? I know my answer, I know yours, so how do you think your patients feel? My staff is very proud to be working in my office because of the lasers. Our patients rave about less injections, no post-op pain. Most common question we get asked is, why don't more dentists use lasers? And all I can say is, I don't know, but I would not practice without them. Many comment and say, I wish they had this when I was a child. I would have had much better teeth. I use photobiomodulation PBM more than any other laser treatment every single day in my office. I would not do an extraction, an endodontic procedure, or a surgery without it. It gives us a totally different healing paradigm. One of the most amazing and rewarding parts about using laser PBM in my practice is the ability to treat medically compromised patients. This has allowed me to treat many of my long-term patients as they have gotten older and their health has declined. It also allows me to help my patients that are receiving chemo and radiation therapy for cancer. It allows me to decrease their symptoms if they do occur, and in many cases to prevent them. So I urge you to register for the course that Dr. Gerry Ross, Dr. Arun Darbar, and I are leading on photobiomodulation on the Dental CE Academy, Saturday, February 13th. Between us, we have over 75 years of actual chairside clinical experience in giving PBM treatments to our patients. Believe me, you will not be disappointed and your patients will love you for it. Thank you.